We're exploring 5 different ways that wellbeing teams and community circle connectors can support people to come home from hospital, avoid hospital admission, or generally support them with their health. And here's a quick overview of all 5. The first is supporting people to come home from hospital. The community circle connector and the wellbeing leader would be part of the multidisciplinary discharge team. When somebody's getting ready to go home, the wellbeing leader would support them to choose their link wellbeing worker, and together with other relevant people, for example an OT, they would co-design the discharge and initial support at home. This would take into account what matters to the person and their priorities, what's needed to keep them safe and well, and linking with friends and family if they're involved. The community circle connector also explores whether the person wants to start the circle straight away or explore that later when they're established at home. The link wellbeing worker coordinates the person leaving hospital and may actually bring them home if necessary. They ensure that they're welcomed home with fresh sheets, milk in the fridge, or whatever a good welcome feels like. The link wellbeing worker is part of the person's team and brings in other wellbeing team members as required. They work using enablement principles, including the support sequence, to focus on self-care, using technology, working closely with friends, family and the community circle, as well as community resources and services. At 6 to 8 weeks, there'll be a person-centred review with the team, the circle, the social worker and any health professionals that are involved. The social worker would have done an assessment to identify the person's outcomes and at this stage whether they're eligible for a personal budget. And the link wellbeing worker and the person would then co-design any future services that the person needs within their budget to achieve their outcomes, and the person will choose any additional team members that are required. The second way is looking at wellbeing leaders and community circle connectors as part of a GP practice. They would be part of the multidisciplinary team and could be directly involved in delivering personalised care and support planning. So if the GP is concerned about somebody being lonely, they may suggest that the person talks to the community circle connector. If somebody needs support at home or a personalised care and support plan, this could be instigated by the GP. There are 5 stages of personalised care and support planning, and you can find out more about those on the Think Local Act Personal website. One way that this could work is that Community Circle Connector could help the person prepare for the conversation by exploring what matters to them, what's working, not working, and their priorities. Preparation might include an assessment by a social worker to see if they're eligible for a personal budget and their broad outcomes. The conversation might take place with a health professional to look at their specific outcomes and ideas about how to achieve these. And the outcomes and actions are recorded on the patient's notes. The personalised care and support planning could be implemented with support from the community circle and the wellbeing team. And then the review would take place with the person, their community circle, wellbeing team and health professionals to look at what's working and not working around their outcomes and what they want to change. The proactive care team is another way that a wellbeing leader and a community circle connector could work out of a GP's surgery. Using this approach, the team would be the wellbeing leader, social worker, community matron and community circle connector. They would work with the top 2 or 5% of people at most of risk of going into hospital. The community circle connector would start the conversation at home with the person, looking at what matters to them, their priorities and their budget. Then the personalised care and support planning conversation would be had with the wellbeing leader, social worker, community matron and community circle connector around the kitchen table with the person to look at their priorities and how they can be delivered. This might include support from a community circle, or it might require support from a wellbeing team if the person requires personal care support. There would be a person-centred review either just with the community circle connector and the person, if that's what's required, or a broader review involving the whole of the team. The next approach, a leader and a community circle connector as part of a multidisciplinary team as part of a virtual ward. They would be taking referrals from GPs and at the team meeting decide who the best person is to start the conversation with the person and to do an assessment or start the personalised care and support planning process. This would identify the person's needs, their outcomes and their priorities. And the treatment and support at home would not only involve the health professionals involved, but also support from a community circle and support from a wellbeing team if the person needed personal care support. Wellbeing teams use reablement principles, so alongside the health professionals, the focus would be on supporting person to get to use their skills and abilities to the best effect to look after their own health. There would be regular person-centred reviews with the community circle, the wellbeing team and health professionals. The hospice at home process would be similar to the virtual ward. For example, the wellbeing leader and community circle connector would be part of the hospice at home team. They'd identify who needs to do the assessment of needs and talk to the person about their outcomes, and also how to have the end-of-life conversations and advanced care planning decisions. The person might receive support from a community circle and support from a wellbeing team if they need help with personal care. And of course, the care and support would be delivered at home. The community circle, wellbeing team and health professionals would come together at regular person-centred reviews, and the community circle could continue to support the family and friends after the person's died. All of these approaches integrate the support that's provided by family, friends and voluntary sector through the role of the community circle connector, and really do bring together health, social care and friends and family and community support wrapped around the individual, starting with what matters to them and their priorities. Reablement principles and community navigation are built into the way the wellbeing team and community circles work. Now, you might be thinking that lots of this or some of it looks similar to work you're seeing other people doing, and we hope to keep building on existing best practice as well as testing out some newer approaches. If you'd like to keep in touch and learn about what we're doing and trying, please go to wellbeingteams.org and sign up for our newsletter. Thank you.